The good news about depression is that safe and effective treatment is now available for most forms of the disease. You will hear about how to recognize the signs and symptoms of depression and how to obtain the best treatments for depression in this video. Dr. Kevin Kerber is an expert at the University of Michigan Depression Center in diagnosing and treating depression.
There's not necessarily a clear marker of when one crosses a clinical threshold and increases cause for concern. But here are a few of the signs and symptoms that could be red flags. Feelings of sadness or not enjoying life in your usual ways.
I can even remember back when, while I was playing, and the greatest job in the world, you know, being in the NFL and being a starting quarterback for a team, and yet I turned to a friend of mine and said, "Are you happy?" "I'm not happy."
Having trouble concentrating or making simple decisions.
And I felt somewhat in a situation that was demanding, but I didn't really realize how demanding. Because it was always, to me, I can do this, and I can do it well. I don't mean to sound arrogant about it, but I mean, I just had the confidence in being able to perform my job, the family, and balance it all, and I couldn't anymore.
Perhaps getting too much or too little sleep.
So the sadness part was there, and sleep problems, you know, not being able to sleep at night, ruminating thoughts that go through your mind at night, like, you know, worry, or, and I don't want to say that because I'm not that much of a worrier, but it was more of a feeling of overwhelmness.
Feeling irritable or restless.
It took a lot to slow me down, but this depression really did me in. I started getting weepy at work and irritable with my kids.
Having physical symptoms such as headache, digestive problems, backaches, or muscle pains.
When my back started to hurt, I went to see the family doctor, and I don't think I would have said anything if he wouldn't have asked, but when he did, it just all started spilling out.
Most of us have at least some of these symptoms at times in our lives. But there are some other questions we can ask to determine how serious the situation is and whether help is needed. Are the symptoms of depression and anxiety interfering with the ability to function? Have the symptoms been present for 2 weeks or longer?
But I started yelling at my wife and losing my temper with the kids, and then I would feel overwhelmed. I was irritable all the time.
Are the symptoms leading to changes in your longer-term social or work behaviors? For example, withdrawing from friends, stopping participation in a softball league, or watching TV for several hours a day longer than you used to, or changes in your work habits or engagement at work.
I couldn't shake that feeling of gloom and doom. I just felt like I was going to lose everything. I didn't want to be bothered with anybody. I was tired all the time. And sleep, forget about it.
Are you able to function but having symptoms that are causing you intense distress? For example, you're able to show up at work or able to get the kids off to school, but it is with great difficulty now that you are able to do so.
I got this very overwhelming feeling. I just couldn't do this anymore. I just couldn't do this anymore.
Are you beginning to abuse alcohol or drugs?
I was staying at my buddy's house temporarily. He'd go off to work during the day. I'd sit around and drink beer day and night. You could say I was pretty loaded most of the time.
If you suspect that you are depressed and might need professional help, you have many options. You may want to take a quick survey that will give you additional information on whether you are depressed. You can find the survey on the Depression Center's website, www.depressioncenter.org. You can also speak to your primary care physician.
I see many patients during the course of a day who are struggling with depression. Depression is a very common problem in patients who see family physicians, but it is often hidden by the symptoms of other medical problems. Patients often do not recognize the connection between their fatigue, pain, or sleep problems and depression. Patients frequently tell me that they're not feeling like themselves, they're irritated all the time, or that it's hard for them to take care of their responsibilities at work or at home. They often think their difficulties are due to their diabetes, or heart disease, or arthritis, or their lung disease. They think less often that the problem might be depression. There are several possible directions you and your doctor might choose depending on your situation. Sometimes I may make an initial evaluation and suggest that the patient simply come back again in a week or two. Sometimes, after I hear what's going on, I might want to prescribe an antidepressant medication. And sometimes I may suggest a referral to a therapist to provide more supportive and therapeutic counseling. But the most important thing to remember is that it always helps to share what's going on, both physically and emotionally, so that your family physician can help you think through the best way to get better.
It often helps to talk to a trained counselor about your concerns, goals, and ways of coping.
I was surprised. It helped just to talk to someone.
You can also call 211, which is the Health and Human Services version of 911. It is available in most counties throughout Michigan. They can walk you through resources that are available for your specific needs.
I'd say 211 made a big difference in my life, helped me get it back together.
The goal of therapy is to go back to being your old self, or in some cases, feeling better than your old self. There are many ways to get help. Don't be afraid to ask.
It was worth it to me to take those few hours out of the week to talk to someone and to take the medication. I guess everyone needs a little help sometimes.
There is help. There are many resources you can tap. It may take some work, it will take some persistence, and no one can promise you that you will find the help you need in one phone call. But we and others want to assist you in getting the services you need. Good treatments are available. Go, get some help. You will find the services that you need.
If you have this issue, you shouldn't be ashamed of it. You should have it dealt with. You should get treatment for it.